I'm Dr. Shay, and I'm a physician at Protea Medical Center in Tempe, Arizona. And today I'm here to talk to you about stress because it's something I find I talk to many patients about in our visits. So, when we think about stress, we can essentially divide it up into two different types. We've got acute stress, which is a immediate response to a perceived threat. So, we can think of an injury or an illness or a near accident. When we think about chronic stress, we can think of things that tend to affect us over longer periods of time. So, this can be things like an aging family member, or a demanding job, or a unhealthy relationship. Now, what happens with acute stress is that there's a cascade of hormones that get released in response to acute stress. So, when we have a perceived threat, our part of our brain called the hypothalamus releases a hormone called corticotropin releasing hormone, or CRH. CRH then goes to the pituitary gland, which is a gland that sits at the base of our brain and tells it to release another hormone called ACTH, or adrenocorticotropic hormone. From there, ACTH travels to the adrenal glands, which are glands that sit on top of the kidneys, and signals our adrenal glands to produce cortisol, norepinephrine, and epinephrine, our stress hormones. When this system is activated, this is known as our sympathetic nervous system, or our fight or flight response. So we can think in instances where we're under acute stress, we tend to get symptoms that are associated with that. Let's say a racing heart or an elevation in blood pressure. Behind the scenes, the other things that happen is we have a shutdown of our digestive processes. We have an increase in blood sugar because we are wanting to sustain ourselves for survival to be able to fight or flee, fight or flight. After the perceived threat, the adrenal glands talk back to the brain and shut the process down, calm everything down, calming down the surge of cortisol, norepinephrine, epinephrine, and we are able to recover. With chronic stress, the same cascade occurs in the body where we get signaling from the brain to the adrenal glands. But what happens with chronic stress is that over time, our system gets flooded or gets overburdened by that constant signaling. When we have elevated levels of cortisol, our major stress hormone, circulating in our bloodstream, we can see an impact on our health by increased blood pressure, maybe sleep disturbances, insomnia, dysregulation in blood sugar metabolism. Maybe we start to have cravings for certain foods like fats and sugars. These are going to be responses to chronic stress and too much cortisol in the system. Now, what happens over time with that feedback loop when we think about acute stress, how there's after an acute stress, a signaling back from the adrenal glands to the brain to calm things down, because we don't have that recovery period, because that signaling is not occurring because our bodies are flooded with cortisol, our major stress hormone. When the system starts to become bombarded by elevated levels of cortisol over time, what happens is the adrenal glands become exhausted. They become tired. They can't keep up with that cortisol production. Because they can't keep up with that cortisol production, there's no feedback signaling back to the brain to slow anything down. Our tissues, we have receptors for cortisol on many tissues in the body, become saturated. We become cortisol resistant. When this miscommunication occurs between the adrenal glands and the brain, this leads to a decrease in overall cortisol production. So, when we think about cortisol, it's also important to know that cortisol naturally follows the body's normal circadian rhythm, which is our sleep wake cycle. So, first thing in the morning, cortisol should be at its highest levels. And cortisol really is kind of a Goldilocks hormone. We like to see it not too high and not too low, especially first thing in the morning. It's going to make sure that we have enough gas in our tank or enough energy to get throughout the day. As the day wears on, by the time we are preparing for bed, cortisol should be at its lowest point. That's when melatonin turns on, and cortisol should be at its lowest point, and we should be able to fall asleep. What happens a lot of the time, and what I see mostly in clinic, is patients come in this exhausted state, and their cortisol levels are not where they need to be in the morning. Because there is some level of cortisol dysregulation, they tend to come in with symptoms related to difficulty sleeping or waking more frequently, insomnia type picture, maybe digestive disturbances like bloating or heartburn. We often see low levels of cortisol related to hair loss, anxiety and depression, energy level depletion, menstrual irregularities, weight gain, fertility issues. The reason this happens is because there's an interplay between our cortisol, our stress hormone, our thyroid hormones, and our sex hormones. So when we look at the interplay between these hormones, cortisol is going to be a major contributor to how the rest of the system functions. When we think about how cortisol is produced in the body, the backbone of cortisol production is progesterone. Progesterone is a major fertility hormone. In order for our body to produce cortisol, we need progesterone as a precursor. So over time, if we start producing too much cortisol to the point where the body becomes burnt out, we may also see a deficiency in progesterone levels, which can lead to symptoms associated with too much estrogen in the system. When we think about too much estrogen in the system, we might think of crampy, painful periods, heavy periods. Often with progesterone deficiencies, we will see difficulty in trying to conceive. And this all goes back to that stress picture. Now, thyroid also has a big piece in this system as well, because anytime we're under chronic stress, our body has a more difficult time producing active thyroid hormones. Our thyroid gland sits in our neck and is an organ that is responsible mainly for metabolism and energy in our body. This is one thing that we do at Protea that we look into to get a very comprehensive look at how you are doing specifically. So we will run a comprehensive lab panel on you, typically to assess for a wide variety of things, but included on most of our panels, we're going to look at sex hormones. We're going to look at cortisol and your stress response. We're going to look at your thyroid, and we're going to see, where are those things? Are they optimal? What symptoms are you having? From there, we can effectively determine which types of treatments may work for you. Now, are we able to take away your stress? No, but we're able to optimize and make you more adaptable to certain stressors by working on potential for thyroid irregularities or cortisol irregularities or sex hormone irregularities. Because these are working in such balance with one another, we can really focus on bringing these into balance and making you feel like yourself again, where you don't have these symptoms associated with anxiety or depression, where weight gain doesn't have to be a problem for you, where menstrual irregularities can subside. Periods aren't as painful. Fertility can be achieved. You wake up in the morning with energy. You go to sleep at night and you're able to sleep through the night. All of this is so important to you feeling your best self. Also at Protea, we have a movement studio where we can help people achieve their exercise goals. Exercise is going to be hugely helpful for stress levels. We also have nutritionists on board because a nutrient-rich diet, a nutrient-dense diet is going to be very beneficial for hormones in general. If this feels like you, just know you're not alone. It is something we see so frequently in clinic. And if you're thinking that you could use some support or help in this regard or looking to optimize your health, feel free to book an appointment.